treating obesity, it's just such a huge health challenge globally, isn't it?
It really is.
And for so long, the main advice, it's been diet and exercise. And look, those things are absolutely vital, no question.
Foundational. Yeah.
But for so many people, it feels like biology just steps in and makes sustained weight loss this incredibly difficult uphill battle.
That's exactly right. It's like you're fighting your own body sometimes.
Yeah, and just trying to push against those biological signals with lifestyle changes alone, it's often not enough for everyone dealing with what we now understand is a really complex chronic disease.
That's a really crucial point. We've thankfully moved past that simplistic view that weight is just about, willpower or lifestyle choices.
Right.
The science is so clear now. Obesity involves these really intricate biological systems, hormones, metabolism, appetite regulation.
All working together.
Exactly.
Yeah.
And these systems can actively fight back against weight loss efforts. They often try to drive weight back up, even if someone's initially successful.
Which is incredibly frustrating for people.
Absolutely. And it's why medical guidelines are increasingly saying, look, for some people, anti-obesity medications should be part of a comprehensive treatment plan.
And speaking of comprehensive treatment, we've got some research in front of us today that honestly, it feels like it could be a real game changer in how we approach obesity medically. We're doing a deep dive into a major study published in the New England Journal of Medicine. It's reporting the results from a big trial called SURMOUNT-1.
Yes, SURMOUNT-1. And our mission today really is to unpack what this study found about a new medication, Tirzepatide.
Tirzepatide.
And figure out what these results, which, spoiler alert, show some pretty impressive numbers, what they might mean for people living with obesity.
Okay, so before we jump into Tirzepatide itself, let's just build a little more on that idea of obesity as a chronic disease. You said biology fights back. Can you, paint a picture of what that actually means inside the body?
Sure. Think of it like this. Your body has these really sophisticated hormone systems basically designed to stop you from starving.
Survival mechanism.
Exactly. Hormones from your gut, your fat tissue, your brain, they're constantly talking to each other, regulating hunger, fullness, how much energy you burn. Now, in obesity, these signals can get kind of scrambled or dysregulated.
How so?
Well, the body might produce less of the hormones that say, hey, you're full, or maybe more of the ones that scream, I'm hungry. Metabolism might even slow down a bit when you cut calories, trying to conserve energy. It's almost like your body's internal weight thermostat has been set higher and is defending that higher weight.
So it's not a lack of effort, it's biology pushing back.
Precisely. It's not a moral failing, it's physiology.
Okay, that really helps understand why just saying eat less, move more isn't the whole story for so many people. And that leads us perfectly to Tirzepatide. What is this medication? How does it actually work with those systems?
Right, so Tirzepatide, it's a novel injectable medication, a peptide molecule. And its mechanism is quite cool because it doesn't just hit one target. It actually activates two different really important hormone receptors. Yep. The GIP receptor that stands for glucose-dependent insulinotropic polypeptide, and the GLP-1 receptor, which is glucagon-like peptide 1.
GLP-1, I think people might have heard of that one, like semaglutide.
Exactly. GLP-1 agonists are already used for type 2 diabetes and for weight management. GIP and GLP-1 are actually natural hormones, our gut releases, especially after we eat.
What do they normally do?
They do a few key things. They tell the pancreas to release insulin. They slow down how quickly food leaves your stomach, which helps you feel fuller for longer. And they talk to the appetite centers in your brain.
Ah, okay.
So Tirzepatide, by acting on both GIP and GLP-1 receptors, it essentially mimics and kind of boosts the effects of these natural hormones. This leads to reduced appetite, feeling more satisfied after eating, and possibly some other metabolic benefits too.
So it's like amplifying the body's own fullness signals. You mentioned it was already approved for type 2 diabetes.
That's right. But this study, SURMOUNT-1, this was specifically looking at its effects in people who had obesity or were overweight but did not have type 2 diabetes.
That's a really important distinction for these results.
Crucial, yeah.
Okay, so who are the people in this SURMOUNT-1 trial? Give us a snapshot.
It was a big one, a large phase 3 trial. Run in multiple countries, 9 countries actually. They enrolled 2,539 adults.
Wow, okay.
The average participant was about 45 years old. Their average starting weight was around 105 kilos, which is what, about 231 pounds?
Yeah, roughly.
And the average BMI was 38. Now, to get into the study, you needed a BMI of 30 or more, which is the definition of obesity, or a BMI of 27 or more if you also had at least one weight-related health issue.
High blood pressure or sleep apnea.
Exactly. High blood pressure, dyslipidemia, that's unhealthy, cholesterol obstructive sleep apnea, or cardiovascular disease. But again, a key point. People with diabetes were specifically excluded from this trial.
Okay.
And the paper also notes that these participants had tried losing weight before with diet and exercise, unsuccessfully. So these weren't people new to trying.
Right, people who've likely run into those biological barriers we talked about. So how did they actually run the study? It was 72 weeks, you said.
Yeah, 72 weeks. It was set up using the gold standard for this kind of research.
Yeah.
Double-blind, randomized, placebo-controlled. Meaning participants were randomly assigned to get either a placebo injection, basically a dummy shot with no active drug, or one of 3 different weekly doses of tirzepatide. 5 milligrams, 10 milligrams, or 15 milligrams. It was subcutaneous, so just under the skin. And neither the participants nor the researchers knew who was getting what until the end. That's the double-blind part.
Got it.
And here's a really critical piece. Everyone in the study, including the placebo group, got standardized lifestyle counseling.
So it wasn't just the drug versus nothing.
No, absolutely not. It was the drug plus lifestyle support, or placebo plus the same lifestyle support. That support included counseling on healthy eating, aiming for about a 500-calorie daily deficit, and getting at least 150 minutes of physical activity per week.
So everyone had that baseline support. The only difference was the active medication.
Exactly. That lets you isolate the effect of the drug itself, on top of lifestyle changes. And they didn't just start people on the full dose right away.
Oh, right. You mentioned dose escalation.
Yes, there was a 20-week period where they gradually increased the dose. Start low, go slow. This helps manage potential side effects, especially the GI ones that can happen with these types of drugs.
Makes sense. So after those 72 weeks, what were the main things the researchers were measuring? What were the primary goals?
They were focused squarely on weight loss. 2 main things. First, the average percentage change in body weight from baseline to week 72 for each of the groups.
Okay, the average loss.
And second, the percentage of participants in each group who achieved at least a 5% reduction in body weight, which is generally considered a clinically meaningful amount of weight loss.
And how did they analyze that? You mentioned a specific term.
Yeah, they use something called the treatment regimen estimate. It's a statistical approach that basically aims to estimate the effect of the treatment if people adhere to it as planned, regardless of whether they actually finished the full 72 weeks or stopped early for any reason. It gives a good picture of the drug's potential efficacy.
Okay, stage set. We know the who, the what, the how. Let's get to the results, the numbers. What did they find?
Right, this is where it gets really striking, using that treatment regimen analysis at 72 weeks. The placebo group, remember, lifestyle support, only they lost an average of 3.1% of their body weight.
Okay, so lifestyle alone had some effect.
It did, about 3%. Now compare that to the tirzepatide groups. The 5 milligram group lost an average of 15.0%.
15%.
The 10 milligram group lost an average of 19.5%.
Whoa, almost 20%.
And the highest dose, the 15 milligram group, lost an average of 20.9%.
Over 20% average weight loss. Let's put that in perspective again. Average start weight was 105 kilos, 231 pounds. A 20% loss is 21 kilos.
Roughly, yeah.
That's around 46 pounds on average. That's a huge difference for someone.
It's substantial. And critically, the study found that the weight loss with all 3 doses of tirzepatide was consistently significantly greater than the placebo group. The p-value was less than 0.001, meaning these results are highly unlikely to be due to chance.
So it wasn't just the average loss, right? The paper also talked about how many people hit certain weight loss targets.
Absolutely.
Yeah.
And this really shows the consistency of the effect. So that primary endpoint, achieving 5% or more weight loss, in the placebo group, 35% of people hit that. With tirzepatide, it was 85% on 5 milligrams, 89% on 10 milligrams, and 91% on 15 milligrams.
91%. So almost everyone on the highest dose lost at least 5%.
Pretty much. Now let's look at bigger thresholds, losing 10% or more, about 19% on placebo. But with the tirzepatide, 68.5% on 5 milligrams, 78% on 10 milligrams, and 83.5% on 15 milligrams.
Huge difference. Keep going. 15%.
Losing 15% or more, only about 9% on placebo. With tirzepatide, 48% on 5 milligrams, almost 67% on 10 milligrams, and over 70.6% on the 15 milligram dose.
Wow. Okay. And the really big one, 20% or more.
This is where it gets truly remarkable. Just 3% of the placebo group lost 20% or more with tirzepatide. 30% on 5 milligram, 50%, half the participants on 10 milligrams, and nearly 57% of 56.7% on the 15 milligram dose lost at least a fifth of their starting body weight.
More than half the people on the top two doses lost over 20% of their weight. That is just,
Yeah.
that's not something you typically see with medications, is it?
Not historically, no. And they even looked as an exploratory analysis at who lost 25% or more. Even there, it was significant, only 1.5% on placebo, but 15% on 5 milligrams, 32% on 10 milligrams, and 36% on the 50 milligram dose hit that 25% or more weight loss mark.
36% lost a quarter of their body weight or more.
Yeah. And the authors actually point out in the paper's discussion that weight loss in the range of 25–30% is typically what you see after bariatric surgery.
So this is suggesting that for a pretty large chunk of participants, this medication plus lifestyle was getting results in the same ballpark as surgery.
For a significant minority, yes.
Yeah.
It's achieving outcomes that, for many, were previously only thought possible with surgical interventions.
That's a really powerful comparison. Okay, so the weight loss numbers are clearly impressive. But weight loss isn't just about the scale, right? It's about health. Did they see improvements in other areas?
Yes, and that's another really important part of the story. They saw significant improvements across a whole range of cardiometabolic health markers.
Like what?
Waist circumference dropped significantly. That's a good indicator of visceral fat, the dangerous fat around your organs. Blood pressure, both systolic and diastolic, the top and bottom numbers came down.
Good for heart health.
Definitely.
Yeah.
Lipid levels improved too. Triglycerides went down, LDL, the bad cholesterol went down, and HDL, the good cholesterol, actually went up. All positive changes for cardiovascular risk.
And there was something striking about prediabetes too.
Yes, this was really interesting. They looked at the participants who started the trial with prediabetes, meaning their blood sugar was high, but not yet in the diabetes range.
Okay.
By the end of the 72 weeks, in the tirzepatide groups combined, over 95% of those people had reverted to normal blood sugar levels.
95%. Compared to placebo.
Compared to about 62% in the placebo group. So a huge difference in resolving prediabetes.
That's incredible. Anything else? Did people feel better?
They seemed to. They measured participants' self-reported physical function using a standard questionnaire called the SF-36.
What's that measure exactly?
It asks about things like how your physical health affects your daily activities, your mobility, your energy level, pain. And the scores on that physical function part improved significantly more with tirzepatide than placebo.
So beyond the lab numbers, people were actually reporting feeling better and functioning better day to day.
That's what the data suggests, yes.
Did they look at body composition? Was it just water weight or?
Good question. They did a subgroup analysis using DEXA scans, I believe, and they found the weight lost was primarily fat mass. Actually, they reported about 3 times more fat mass was lost compared to lean mass, like muscle.
Which is generally seen as a good thing during weight loss, right? Preserving muscle.
Yes. Preserving lean mass while losing fat is generally the goal for healthier weight loss.
Okay, so really impressive efficacy, broad health benefits. But every drug has a flip side. What about safety and side effects?
Right. Always crucial to examine. Overall, adverse events, side effects of any kind, were pretty common in all groups, including placebo. About 72% in the placebo group reported at least one.
Which tells you things just happen over 72 weeks.
Yeah, exactly. But it was slightly higher with tirzepatide, ranging from about 79% to 82% across the doses.
And what were the most common ones? I'm guessing stomach issues.
You guessed right. Very typical for this class of incretin-based drugs. The most frequent side effects were gastrointestinal.
Specifically?
Nausea was the big one, reported by roughly a quarter to a third of participants on tirzepatide, depending on the dose. Diarrhea was next, around 19% to 23%. Then constipation, about 12% to 17%.
Okay.
And also things like dyspepsia, indigestion, some vomiting, and decreased appetite, which, of course, decreased appetite is partly why it works for weight loss.
Right. That's kind of expected. Were these GI issues severe, though? Did they make people stop the drug?
The study reports they were mostly mild to moderate in severity. And, importantly, they mainly happened during that initial dose escalation period, the first 20 weeks.
As the body adjusted.
Exactly. They often lessened or went away completely as people continued the treatment, but some people did find them difficult enough to stop the medication.
What were the dropout rates due to side effects?
They were higher in the tirzepatide groups than placebo. Placebo was about 2.6%. For tirzepatide, it ranged from 4.3% in the 5 milligram group up to 7.1% in the 15 milligram group.
So 7% on the highest dose start because of side effects. Manageable for most, but not everyone.
That seems fair to say, yeah.
Were there any other, perhaps more serious safety signals they watched for?
Yes, they looked closely at what they call adverse events of special interest. Things like pancreatitis, inflammation of the pancreas. That was rare, and the rates were similar across all groups, including placebo.
Okay, that's reassuring.
Gallstones, or cholelithiasis, also had similar low rates. Gallbladder inflammation, cholecystitis, was slightly more frequent with tirzepatide than placebo, but still very low, 0.6% at most.
And is that expected with weight loss?
It can be. The paper rightly points out that gallbladder problems are a known risk with any significant or rapid weight loss, whether it's from meds, surgery, or even just aggressive dieting. Losing a lot of weight quickly changes bile composition and can increase the risk of gallstones forming.
Ah, okay. So it's potentially a consequence of the weight loss itself, not necessarily the drug directly.
It's often hard to disentangle, but yes, it's a known association with significant weight reduction by any means.
Got it. Anything else on safety? You mentioned COVID.
Yeah, the trial ran smack dab in the middle of the pandemic. The authors noted that COVID-19 affected a lot of participants and sadly contributed to some serious adverse events and even a small number of deaths across all groups, placebo included. It just highlights the real-world challenges of running huge trials during that time.
Definitely adds context. Okay, so stepping back now, how do these SURMOUNT-1 results for tirzepatide compare to other weight loss medications already out there?
Well, they certainly seem to be pushing the envelope. If you look at older anti-obesity drugs, the ones approved before these newer incretin drugs, you're typically seeing placebo-adjusted weight loss around, say, 3%, maybe up to 8 or 9% over a year.
Huh.
Then you have semaglutide, the GLP-1 agonist, approved for weight loss at the 2.4 milligram dose. In its key trials, it showed about a 12.4% weight loss beyond placebo, and about a third of participants hit that 20% or more loss mark.
Right, about a third hit 20%, and with tirzepatide here in SURMOUNT-1.
The mean placebo-adjusted loss ranged from about 12% for the 5 milligram dose up to almost 18%, 17.8% for the 15 milligram dose. And crucially, we saw 50% or even 57% of participants on the higher doses hitting that 20% loss milestone.
So significantly more people reaching those really high levels of weight loss compared to what was seen with semaglutide.
It appears that way, yes. Now, you always have to be a bit careful directly comparing across different trials. Participant groups might differ slightly. Study design.
Sure. Apples and oranges sometimes.
A little bit. But the sheer magnitude of the average weight loss here, with the 10 milligram and 15 milligram doses, and especially the high percentage of people achieving 15%, 20%, even 25% loss, it looks very substantial. It suggests potentially a stronger, maybe more consistent effect for a larger number of people than we've seen before with medication.
Okay. Any final points on the study's strengths or weaknesses that the authors mentioned?
Yeah, they highlighted strengths like the large size, the global reach, the high completion rate despite the pandemic, and that consistent lifestyle counseling across all groups.
Which boosts confidence in the drug effect itself.
Exactly. For limitations, they acknowledge that people who volunteer for trials might be more motivated than the average person with obesity, which could skew results slightly.
Makes sense. Also, while participants had obesity, their overall cardiometabolic risk factors at the start were relatively normal on average, which might have, paradoxically, limited the room for showing even bigger improvements in things like blood pressure or lipids, even though significant improvements were still seen.
Okay.
And they also noted only a small number of participants were in that lower BMI category of 27 to 30 with complications, so maybe more data needed specifically for that group.
Got it. So let's try to wrap this deep dive on SURMOUNT-1. The big takeaway seems to be, this study in the New England Journal of Medicine showed that weekly tirzepatide, when added to lifestyle support, resulted in really substantial, sustained weight loss for adults with obesity but without diabetes.
Absolutely. And not just weight loss, but significant improvements in a lot of important health markers, too. Blood pressure, cholesterol, blood sugar.
And the sheer percentage of people hitting those high weight loss targets, 15%, 20%, even 25% levels, often compared to bariatric surgery, is particularly striking. It really is. The data presented here definitely offers a new benchmark, perhaps, for what might be achievable with medical therapy for obesity.
So that leads to maybe a final thought for you, the listener, to mull over. Given this level of weight loss, the magnitude and consistency shown in SURMOUNT-1, sometimes approaching surgical levels for many, how might medications like tirzepatide fundamentally change the whole landscape of treating obesity? Could this offer a medical path to outcomes that, for many people, only surgery seemed to consistently provide before?
It's a really provocative question, isn't it? It certainly opens up the possibility for many more people to achieve life-changing, health-improving weight loss without surgery. It also forces us to think about, how our healthcare systems will adapt to incorporate and support the use of these powerful new tools effectively and equitably. Big questions ahead.